absence of any cure or vaccine for the novel coronavirus that has killed 5,413 people worldwide and affected over 67,000, how exactly are we fighting this pandemic? There is no vaccine or drug that's an approved treatment of the coronavirus, so now more than any other time, it all really boils down to how communities respond to the outbreak. A comprehensive approach is being taken and must be taken to fight the virus. This involves testing, contact tracing, quarantine, social distancing. All of it is necessary. So what are these measures exactly? Testing involves taking a swab of the nose or throat and samples of sputum. You may also have blood drawn and tested. In the lab, technicians look for genetic sequences specific to the coronavirus. Some labs say they have developed tests that can produce results in as little as 3 hours, but it will usually take longer than that to get results. Mainly those people who show symptoms of cough, fever, shortness of breath are tested, or those who have been in contact with a COVID-19 infected patient or who has been to a region of outbreak. Although these reasons may be fairly broad, early screening and detection will suppress the spread of the infection. Health services use contact tracing to find people who may have been exposed to an infectious disease. There are two types of contacts: close contacts and casual contacts. A close contact is anyone who has been close to someone with COVID-19. This can mean living in the same house or spending more than 15 minutes close to someone with COVID-19, such as on a flight, bus or train or in your workplace. And casual contact is someone who has had contact with the case but not for sufficiently long or too closely. This could mean someone traveling on the same aeroplane who was seated away from the case. For example, they were only close to the person with COVID-19 for less than 15 minutes or were at the same place but not near them. Quarantine is for people who have been exposed to a disease and may fall sick even if they seem healthy at the moment. So Indians brought back to the country from the epicenter of Wuhan in China or Iran were kept or are being kept under quarantine for a period of at least 14 days. The incubation period for this novel virus may be about 14 days, within which symptoms start showing. There's a larger group of people who are under self-quarantine. Now, they don't have any reason to believe they've been exposed, but they are staying home in order to reduce the risk of contracting the virus or spreading the illness. All those people working from home nowadays can be called to be under a sort of a self-quarantine. And finally, isolation is for people who are ill and have been diagnosed with coronavirus and are now a danger to family and visitors. Apart from all this, good personal hygiene must be observed at an individual level to fight this virus. Covering the mouth with a tissue or your inner elbow while coughing or sneezing, wearing a mask if you're coughing or sneezing, washing hands with soap water and using hand sanitizer are ways we can and we must fight this disease.